Happy Valentine's Day, everybody, from a cootified Michelle, because the flu has descended upon Pack Dawson. But yay, real life moment here. This week's episode, I couldn't let it go by without doing its own unique intro. Because this week's episode, we host Dr. Travis Threats, who has an ASHA Fellows as well as an ASHA Honors. And it's the highest award that our organization can bestow upon a colleague. His work in its own right on adult cognitive rehab and the effect of lead poisoning on children's cognitive and language skills, and his work alone is profound. But what has meant the most to me is his ability to marry his faith with our profession. I have watched him witness to myself and to others because he talks about the role of religion from a clinical perspective and how we can support our clients, colleagues, and the caregivers of the patients that we've been called to serve while acknowledging their faith differences and respecting their culture. DEIA matters, and it matters to me because of a multitude of reasons. So on that note, I'll give you the heads up that this conversation can be a little intense on the heart at times. And I'll give you the heads up that when Dr. Threats and I went to go record this episode, I had just found out that one of my patients had passed away. And as I sit here today recording, I am going to ask for a very large favor. Last week, Dr. Chris Kleinert, a highly respected, treasured, and loved audiologist at James Madison University, passed away tragically in a very horrible home accident. I had the pleasure of working with Chris at JMU, and I became very, very close to his bride, Erin, who is possibly one of the most radiant human beings you will ever meet. And now Erin is raising her two daughters alone. And so I know at the end of every episode, we always ask if you got a little love money, send it here. But at the end of this episode, there's a GoFundMe link. And I would be honored if you could support another feeding therapist, faculty member, mentor, colleague, and sending a little love money her way to help support her and her children in the wake of what happened. So this episode hit home for a lot of levels and a lot of reasons, and I cannot tell you how proud of it I am. So I hope you enjoy it, and remember your flu shot, because even with the flu shot, flu A sucks. So, bye. We are honored to have, and I have my phone out so that y'all can hear the litany of awesomeness and kindness that is this man. We have Dr. Travis Threats, PhD, ASHA Honors. He's an ASHA Fellow. He's a Distinguished Scholar and Fellow of the National Academy of Practice. He is the Professor and Chair of the Department of Speech, Language, and Hearing Sciences at St. Louis University. He has an amazing photography website that I follow on LinkedIn. I've just forgot the name of it.
Goddess in the Details Photography. It
Yeah.
also has an Instagram and a Facebook. Actually, most of the pictures are on that. Only some of them are on LinkedIn.
Oh, I got to switch over because I've been following that one on LinkedIn. Y'all, I met him a few years ago through Dr. Elise Davis McFarland in passing at a conference ever so briefly. And then we reconnected at Boston when I went up to you and thanked you for your artwork and sharing of your story and your faith on LinkedIn. And that is something that's so profound. When we have the ability to step out in our faith as part of our culture, as part of who we are as clinicians. Now, the backstory behind today, and I'm already crying, is this weekend I lost my aunt. And this morning I found out that this precious little 3-year-old I've had the pleasure of working with for the last several months passed away very unexpectedly.
Mhm.
And it is in the moment of grief when you see the peace for a 91-year-old woman and
Mhm.
the utter heartbreak of an unanticipated loss in a 3-year-old, that I think it's those moments that break us down. And it's those moments where we can see God in the details, because I was able to bring joy to both their lives and
Mhm.
they brought so much more to mine. So when I said
You,
before we started recording that today was divinely aligned,
mhm.
I meant it.
Mhm. Yeah, we do not always have happiness, but we can always have joy.
Yes, absolutely.
Mhm.
And that's profound. And honestly, this is a talk I have wanted to have you on for a long time, because it also is part of me healing an old wound a lifetime ago when I was a graduate student. I was in my first medical practicum, and I distinctly remember one of the physical therapy assistants telling me, "Oh, honey, you have a blessed day," on a Friday afternoon when I walked out the door. And I said, "Yes, ma'am, you too," just like that. And my clinical supervisor reamed me upside one side, down the other. "How dare you bring faith into this? This is a hospital. God's not in here." I mean, it was, she was talking from a place of hurt, and I know that. But professionally, that was my first encounter with where does my faith fall into my walk clinically and professionally? And that was not a pleasant intro. And over the years, I've had to find myself and define myself in that step. And you, sir, have blessed our stars with your lifetime commitment to not turning away from it and living boldly. And so thank you, longest intro ever, but all of those things like happened before you got here. So hi, can you please introduce yourself and tell everybody who you are?
Okay, my name is Travis Threats. You've already told what my current job is. My area of teaching has been with acquired neurogenic disorders mainly, although that does include some children, as my
Mhm.
classes on cognitive communicative disorders have included pediatric head trauma, as well as lead exposure and prenatal drug exposure. I count all of those things as acquired disorders.
I have a
Uh,
little one that has ASD and lead exposure right now.
yeah, that's
Oh, we have
that's
to
right.
talk about
So I personally think that many of the disorders in children um, do have an acquired basis, and I think there's a combination of congenital factors. But remember, your environment starts in the womb,
Yes.
so there are more environmental factors than we give credit for. And in terms of children in underserved areas, the things that they're exposed to, the trauma. Give you an example. When there's a mass killing, they always, in certain school districts, they rush a team of psychologists. Well, some kids see their own relatives killed. Nobody rushes psychologists in to see them. But that
Yeah.
has an effect on their brain.
Yes.
And when you think about hope, and that is tied with faith, and you talk about executive functioning by definition means you have faith. Now, that doesn't have to be only religious faith, but you have faith that if you do these steps, things will be better.
Hmm.
But when they've done interviews of 3 and 4 year olds in certain neighborhoods and say, "How long do you expect to live to?" And they say 25, and then you wonder why they're not planning for college. Well, if you're only living to 25, it's actually not logical to prepare for college.
Yes.
You live your life what you can get now.
Yes.
So a lot of the problems that we see of poor executive functioning, some of that comes from these environmental things, environmental toxins and such, but some of it comes from your environment. there is a reason not to believe that if you do all these steps, your life will be better.
Mm-hmm.
And that's at the heart of things. So as you said, I have a website. The website has a Christian blog on it, and one of them is on faith and executive functioning.
I have living a very sheltered life. I mean, my parents divorced, but it was upper middle class white family. Both of my parents have college degrees, and I remember the first time going in and doing home health, and it was such a surreal experience to me to go from essentially a nuclear family because both my parents remarried, and on the continuum of trauma informed care and ACEs, adverse childhood events, my pediatric trauma was like a pebble in someone's shoe comparative to a boulder. And going into these little ones' homes, and I'll never forget, I was standing on the front step in downtown Columbia, and a mama said, "Honey, what are you doing standing?" And she pulled me down to the ground, and we crawled into the front door because there was drive-by gang activity. And it was so surreal to me that, and that was a home where I worked with a little one who was trach and vent dependent, shaken baby syndrome. Now we call it non-accidental trauma, but these were variables. And yet that one moment, that fear, that trauma, this house, you walked in and they chose hope. And that's profound. But
right. And that faith is also part of the adult population. When you have a stroke, when you have Parkinson's disease, why work so hard to get your skills back unless you think that this work will lead to results, which means they have to trust you, but not trust your master's degree, your ASHA CCC. They have to look in your eye and see somebody that they believe thinks that they are still important. Because the typical person, when they wake up from a stroke or a head trauma, and they're the most severe at that time, they are not able to eat, they're not able to walk, understand people. Everyone at that moment, when they first get that kind of consciousness, wishes they had died. And it's you, not, again, your clinical skills. We underplay our value in terms of what we mean to people. When we don't realize that that's what they need. So the best thing I've ever heard, it was on a video of a man with head trauma who had made a pretty good recovery. He said, "The doctor saved my life, but the therapist convinced me I had a life worth saving." And that is a missing component, sometimes even in our teaching. We're so busy teaching the technical skills but that's not what patients do. Want you to be competent. They want you to know what you're doing, but they want to have somebody believe in them when they don't believe in themselves.
Yes.
And that's what you communicate. And that's across culture. So the same thing about so the technical aspect also applies to cultures and diversity. It's like it's an academic topic. I tell my students that we have a multicultural class. So we're trying to teach you not to do something stupid, like reach out and shake the hand of somebody where that's not part of the culture across sexes.
I've done that. I did that and I did it.
That's right. So this is what we're trying to teach. But I tell them directly, unless you inherently believe in the inherent worth of all people, which is separate than agreeing with every life decision that person makes, agreeing with their religion, beyond all of that, unless you believe in the inherent worth of all people, you need to leave the field, because we cannot teach you that. We can teach you techniques. I know somebody she's from South America. She actually became a speech pathologist as a second career after her daughter had a severe speech language impairment. So she's clearly bilingual, but she always says it is better to be bicultural than bilingual, So you can learn Spanish, but that does not mean you can work with a Mexican immigrant family,
Mhm.
because what they're looking at is somebody who's looking at them as a person and not as an immigrant. So you could learn the language, but that doesn't mean that they will trust you.
Yes.
Yeah. So that's a very inherent thing. So now, obviously, I do this through my faith, but there are other faiths and they have it. But that the inherent belief in the inherent value of other people, the inherent value of that person with Alzheimer's disease, the inherent value is the part that is so important, and it's actually what our clients are looking for, and that can be across cultures. People don't expect every clinician they work with to be the same religion, race, socioeconomic level as they are. They're looking for somebody who they look in their eye and see somebody who cares about them as a person.
Yes.
It's
And
the universal language if you can do it. So you can know all the facts about a given group in that kind of checklist kind of way that we do. Like cultural competence is the same thing as doing an oral mech exam,
but
you
it
know, to
is
be,
not. But I
but
know
it's not.
exactly what you're talking about because I've seen it taught that way.
That's right. It is taught that way because I remember an early book. Now, some of these people who wrote these early books have now disavowed this, but some of the early books on different cultures, one of the books actually had a section called Characteristics of African American Communication.
Mm.
And one of the things on it was, do not make direct eye contact with people in authority. That's not part of being Black. That's part of being in the Jim Crow South. That's
Yes.
not an inherent value of being a Black person. Yet it was listed as an inherent trait.
Yes.
And I remember I was in school and I was visiting my relatives in Mississippi, and I had a test when I came back. So I had my book out. So one of them picked up the book. So they're reading this section on African American communication. And they said, who's this is what they're teaching you in college? This kind of nonsense? Because they're looking at the list and they don't see anybody, they don't see themselves in it.
Correct.
So, so these things can be revolved around that. So anyway, I've gone off on a kind of a tangent there
No, I love
from the
tangents.
topic that's we're supposed to be talking about.
That tangents are welcome here. My ADHD self totally entertains them regularly.
Mhm.
But wait, okay, so something that I have learned over the years, and I promise my tangent will get us back to our outlined
Mhm.
agenda for the day, folks.
Mhm.
But is when I'm working with a new family and I don't know their culture, their faith. To me, they come in, it's a script: pediatric feeding and swallowing disorders, eval and treat. I might have a primary etiology like Down syndrome, or
Mhm.
maybe congenital heart defect with like vocal fold paralysis. But normally it's just PFD, eval, and treat, and that's it. It is up to me as part of my tiny human intake form to actually sit down and ask those crucial conversations around the daily routines. And folks, y'all, Dr. Frances Burns has encouraged me, and I have poured into y'all, check out family guided routines based fgrbi.com, because they have tools there to guide this thought process and questioning. But it's up to me as part of that intake to ask questions about: how do you start your mealtime? Do you pray together? How do you wash your hands before a meal? What are your social customs? Does the cup reach your lips? But I am a little gray, and in a, eventually will be less gray courtesy of a hair appointment, but um, y'all, I love my lady. But if I don't ask those questions, then I am making assumptions based off of my faith walk, which started out Southern Baptist, transitioned to Methodist, then we went to a Lutheran church and joined, and now we go to Episcopalian church. And I don't know about y'all, but there's a big difference between an Episcopalian church and a Southern Baptist church.
Correct.
But those experiences are the lenses through which I interact with the world. I don't, my I don't know about how Jewish culture plays out around
Mhm.
mealtime, even
Mhm.
though my ex-husband's family was Jewish, but they
Mhm.
didn't adhere
Right.
to those.
Mhm.
So
Mhm.
I say that because don't assume that just because a patient looks like you or
That's
looks
right.
different from you, that they
Mhm.
practice faith.
Mhm.
I've also met those that were Wiccan, and they
Mhm.
have their customs as well that I need
Mhm.
to honor and respect as part of our calling, right?
That's
So,
right. Because even if you don't agree with their practices, their inherent value is still the
yes,
same.
yes, they're a
Right.
human. I want
So
to teach
I
them
always teach
well.
the best diversity assessment is tell me about your life.
Yeah,
And if people think you care, they will tell you because you can't learn all cultures, and even a culture has a subculture. All Southern Baptists are not the same.
yes,
So you can't learn them all, and the only way you can do that, and the other, and this has become a static thing that I say when I give talks on this topic, as well as to my students. There's two basic things to understand. One, everyone is not you. And what I mean by that is some people say, I accept all people. I am the norm, but I accept all these variations. But-
that's not how this works.
that's right. But so that's the first part. So one, everyone is not you. And two, you ain't all that. So this is what you've got to keep in mind. A little humility. Because I was talking to a student, and they were raised. I'm at St. Louis University. This particular student was raised devout Catholic, and she was talking about some other religion and all of that. And I said, "Well, let's say this. Let's say somebody has never heard of Christianity, and you're explaining to them something to them, and you say the central tenet of your religion is a man being tortured to death." Said, how much sense would that make to them? So you got to be a little careful saying that doesn't make logical sense. And how could somebody believe that?
Yeah,
Now, I say that as a Christian, but I'm acknowledging that you've got to be very careful just listening superficially about another religion because they have more in common than you think. But the practices look very different. You know what I mean?
yes,
But the core things, if you get to those, you might find there's more in common than it looks like from the surface.
yes,
You know what I mean?
yes.
So yeah, the whole thing. So give an example. I had a student, again, very devout student. She went ever since high school. She was in college now. She went to Romania and did this Christian mission work. And she said, but there's one group that we don't uh, ever interact with. So they're building homes for people. They're doing all this good work. And I said, why don't you do them? So, well, we don't deal with them because they're devil worshippers. And I said, how do you know they're devil worshippers? And they said, wow, in the middle of their town, there's a sculpture of a snake, and they stand around it and they chant something. I said, do you know what they're saying? She says, no. I said, do you know the language? No. He says, well, how do you know they're devil worshippers? And I said, because it's the snake, and the snake is the devil. And I said, you know, the caduceus, the on the medical symbol has a snake wrapped around it because
Yes,
snakes were used for medicinal purposes, their venom
yes,
and all that. So how do you know that? And so basically, they didn't even. This is a Christian group. Think about this concept that will not reach out to a group because they're devil worshippers. Now, think about this. So if you're supposed to be evangelizing, you could at least ask them, what does the snake represent? And what are you saying? But
yes.
they didn't ask what the snake represented,
I
and they
see.
didn't ask what they're saying.
Yes.
They just said, it's a snake. They're worshiping the devil.
Okay. So that doesn't make sense from a adult perspective, but
Mm-hmm,
as a small child, one of my very bestest friends was Maria Hingle. We all called her Hinkle. She
mm-hmm,
moved to the area. Her daddy was a Marine. She was the first Catholic I'd ever met in my life. I'd
mm-hmm,
never met a Catholic before.
mm-hmm,
And Hinkle had an older brother who had a pet snake, and I was at my very first sleepover at her house, and the pet snake, it was a little green snake. The green snake got out. At the same time, the mom was talking about catechism class. I think I'm saying that right.
Mm-hmm.
And she was like, I got to go practice my prayers to drink blood. You wanted to, I was out, dude. Like 12-year-old Michelle was like, I need to go home now. Like my new best friend drinks blood and her brother has a pet snake.
Right.
Okay. Communication breakdown.
That's right. But what is communion in all religions? You're drinking the body and blood of Christ. Now, some in Catholicism, it's transubstantiation, so it literally turns into it.
Yes, but
In others, it's symbolic. But again, looking at the religion from another point of view, so your ritual practice includes cannibalism.
I
Okay.
mean, when you say it like that,
Yeah.
that's a hard sell.
Yeah, that's right. So my point now, again, I'm not running down religion. I am a Christian myself, but I'm saying that's where all that part comes in. Have a little humility about what you believe. Now you understand the story behind it. There's a whole story. There's an Old Testament. There's a New Testament. There's many things around it. But superficially, you do have to realize what you are saying, that you are taking. So at some point, I think in the life of Christians, and certainly Christians working in healthcare where you deal with tragedy sometimes and things that go wrong, is that you've got to come to a realization and a belief within yourself. Because if you've just taken the stories, well, you've never really absorbed it. And if you've never really absorbed it, I argue you can't really practice it.
And it is not for me and clinically to teach another person how to embrace their faith.
That's right.
It is for me to honor the traditions that they have, but it then puts it upon me to learn about it and to be professionally curious. Just like you said earlier, it's not all about you don't think you know everything. Like I was so excited once a lifetime ago because I had a new family. I'd never worked with an Islamic family before. And I didn't know the cultures. And so the very first thing I did was stick my hand out to shake my hand with the dad. And bless them. It was a great, everybody laughed it off and they taught me as I went along. But I wish I could go back and tell Michelle from 12, 11, 10 years ago, how to do things better and to learn more before you go.
That's right. And that's what we teach in our multicultural class. We teach these communication things. Now, that being said, there are, just like Christianity has a wide range, Muslims have a wide range. Yes. So if the person extends their hand to shake your hand, then shake their hand. Yes. Some women don't cover everything. Some cover just their hair. Some don't dress modestly, but don't cover at all. You know what I mean? So all these variations exist. Yes. And sometimes you just have to you just don't do something and you let the person take the lead. Yes. And then you keep from doing something stupid. So that's what we're trying to keep them from doing. We're not trying to teach them every culture, but we're just trying to teach them that there are things that you do that everybody doesn't do. And since we're in the communication business, you could risk starting the relationship off on the wrong foot by violating these basic communication rules, pragmatic rules.
Yes.
But again, if you ask them, some will be more formal. Some might call you if you want to be called by your first name, but others would be offended culturally if you did that because that's too familiar. Yes. And it'll be difficult for them to have respect for you if you come at them familiar. So, or what you call them. You can never go wrong being more formal, and the person can tell you to go less formal, but you can't go wrong being formal at the beginning. You know what I mean? So, so realize that. So, in case of Muslim and Judaism, they and Christianity all come from Abraham. So there's a lot more commonality than you might think.
Yes.
I'm not saying there aren't some significant differences, but you were talking about the example I give on religion is two Baptists. So let's say the clinician, like yourself, has a cross, and the person, your client, is very religious, and somewhere it comes out that you're both Baptist. So people are thinking, okay, we're the same. And then the clinician says, they're asking about they're exchanging about the weekend, said, yeah, and my sister just got ordained as a minister. And then the client says, oh, no, women are not supposed to be ministers. It's against God's will. So now you've made a mistake. You're both white. You're both middle class. You're both Baptists. Consider yourself devout Christians. Go to church every Sunday. And now you discover there's a difference.
Mm-hmm.
You assumed a similarity that wasn't there. So you have now given information, which, by the way, you did not lead to give, right? And now you're going to now feel a conflict. Yes, you're there as a clinician, but now they've attacked your sister. You know what I mean? So it's going to be hard for you to recover from your sister has done an evil thing. And you're sitting there happy and celebrating it. And so I'm saying you make mistakes both ways. You can make another example. This is from a friend of mine, very devout Christian. She's working in rural Arkansas, an audiologist. They gave the diagnosis, and the person said that they were going to take their child to a faith healer.
Oh.
She wasn't prepared for that. She saw the expression on her face and then said, don't you believe that Jesus healed the disabled? Well, the people with disabilities. So she said she does. So why wouldn't this man heal my son? Now, one could argue, by the way, from a theological point of view, that this man ain't Jesus. Okay, I said it. Right? Now, but I'm openly expressing a bias. Okay, I'm openly saying it.
Yes.
All right. So, but my point is, it is in the Bible. Have been people who have been miraculously cleared. Miracles do happen.
Yeah.
You don't know this man. You don't know whether he's a man who's been given by God these powers, right? I mean, people didn't believe Jesus at first, so you got to be careful just dismissing somebody because he's not the norm. Jesus wasn't the norm.
No.
So you really don't have a right to judge. Now, in her Christian faith, God puts professionals here to heal you, and thus you should take advantage of them. That's her interpretation. These people's interpretation is, I will go directly to this man. Okay. So again, now you have two people, same religion, same level, but they have a different interpretation. Now, what she did, by the way, is she met with the faith healers in the area, talked about what she did, said that she was a person of God. And, but sometimes people need outside help. So the faith healers told them, we're going to do both. You're going to go get this help, but then I'm going to do the prayer that it works. So just because you get a hearing aid doesn't mean your grades are going to automatically go up.
Yes.
Right? And all these things. That's a fact.
Yes.
So these two are not necessarily in conflict.
Yes.
You can get the professional help and pray for your child.
Yes.
So there was not a conflict, because when they went to the faith healer, now the faith healer is encouraging them to do that. So you see what I mean? They've satisfied their professional requirement, have not directly questioned that. So when the child gets these services and they do better, you don't know whether they're doing better just completely from what you did as a clinician or whether God had a hand in improving things for them,
Yes.
making sure it works. So that would be an example of, again, I'm giving purposely examples of people in the same religion on
Mm-hmm.
that. But you said you were Southern Baptist. There are 30 different subdivisions of Baptists: Free Will Baptists, Southern Baptists, some Baptists and ornate women, some don't. Within the Black Baptist subset of the Baptist Church, there are 3 different groups. One calls themselves the Progressive Baptists. They allow ordained women. Then another Black fraction of the larger Baptist Church does not allow ordination of women. So you say, okay, both Black,
Mm-hmm.
both Baptists. So surely these people are the same. No, they are not. Okay. As you know, we had an election. There's a great split on religion, on which of these candidates is really following God. I would
Yeah.
argue that neither were. But again, editorial, I like to be open about what is fact and what is bias. I'm trying to follow what I preach, right? It's all right to have a bias. You should just say it's a bias and
Yes.
not declare it the truth. Okay?
Uh-huh.
So I think one could argue that neither political party is walking with Jesus. Yeah, I said it out loud.
I love you. Yes.
Okay. So let's not let that separate you. So I've got a student who said, I couldn't treat somebody wearing a Trump hat. No.
No.
We
No.
cannot do that. I'll give another specific example here that's specific to, maybe specific to SLU, but not just SLU. I had a student who did not want to treat, she had been assigned this child here in the clinic. She did not want to treat this child because the child, they were had lesbian parents. They were adopted child,
Nice.
lesbian parents, and she did not want to see the child. In fact, she told me that as a Catholic university, she was very disappointed that I would even allow this child to be in the clinic with these parents. Okay? Now, it is not my job to convince this student to believe in gay marriage.
Mm-hmm.
Just isn't.
Nope.
That is a religious belief. But here's how I handled it. I started small and built up. I said, do you think this child has done anything wrong? She said, no.
Mm-hmm.
Does this child's communication disorder going to interfere with their success in whatever they choose to do in life? Yes. Can you work with this child without working with the parents? No. Okay, so let's establish that.
Mm-hmm.
So I thought, well, that wasn't far enough. Let's stay with your own line of reasoning.
Mm-hmm.
So I said, if you were out with your friends and you had a child client, heterosexual married couple, and you saw the man out with another woman and he was clearly cheating on his wife,
Mm-hmm.
would you stop seeing the child? And she said, no, I wouldn't stop seeing the child. I said, but their father is a sinner.
Yes.
And the father is committing a sexual sin.
Yes.
A sin is a sin. Last
Yep.
I checked, we don't get to pick the hierarchy.
Nope.
So I'm not trying to convince you about anything, but I do want to tell you. So I said, so are you for the rest of your life going to give all of your clients a moral spirituality test? And if they fail it, refuse to see them? I said, we can't. Our moral obligation and your moral obligation as a Christian is to help and serve others.
Yes.
So, but you notice here, I did not go into a tirade saying that you have no right to believe that.
No.
But I did say you do not have a right not to see this child.
You led with a rational argument in a time when a rational faith-based argument is scarce.
That's right. Right. But I said so many in a university setting would be talking about kicking the student out.
Yes. No, it's a teachable opportunity, but this is
Yeah.
where And these are the meaningful conversations
Hmm.
that are not had. These or because in most academic programs, not
Hmm.
all of them,
Hmm.
but in most academic programs, faith, even though it is intrinsic within cultural humility, because
Hmm.
I do not like the term cultural competence. I have
Hmm.
previously used it, but
Hmm.
you can never be competent in somebody
Right.
else's culture.
No.
Um, and but it's so folks are so afraid to hold and go there in depths of conversation
Hmm.
for fear of their positions, for
Hmm.
fear
Right.
of retaliation. But
That's right. So
this is
what I told this, so let me tell you the end of the story. So she did see the child, and here's what she said at the end of the semester. She said, these parents really love their child.
yes,
And
they
notice
do.
I didn't necessarily, my goal wasn't to change her religious views. And I don't know if she did. I don't know. That wasn't my goal. I don't know whether she did or not. But she came to a realization that these people were capable of love.
Yes. Yes. There's feelings. Oh dear God Almighty, bless it. My grandma would say it takes all kinds to make the world go round, and that
Mhm.
yes, the sun is following me, so forgive me as I wiggle
Okay. Right.
around.
So there was her lesson. I don't know what she's taken. This was years ago. I don't know if she's changed her mind. If she hasn't, that is actually not my concern because we accept we can't say we accept some diversity, but some diversity is not allowed.
Yeah,
Others diversity are not allowed. Diversity of thought is allowed.
yes. Um, I've had a couple come up where it's a what about providing services for a transgender client?
Mhm.
Or do you know Dr. Grace from North Carolina Central University?
Yeah, I know her quite well. Actually, I was just at a ASHA convention. I was with a group of people, and we were at dinner together.
Yes, she has kind of taken me under her wing and
Mhm.
mentored me, and I know
Mhm.
that one of her passion areas are uh, pediatric feeding and swallowing disorders and transgender care.
Mhm.
And I got to see her lecture on it at Embasla in not this past year, but so not 2024, 2023.
Mhm.
Um, and it was fantastic watching her lecture. And she is very much a woman of faith.
Mhm.
And um, her explanation behind why she chooses to help is just that to me is an example of a healer. You were talking about being a healer, right? Like
Mhm.
that's I think if we are called into the profession, that's us being used as healers
Mhm.
because we are there to, I am here to fulfill a calling. And that is an
Mhm.
integral part of me.
Mhm. Right. And here's the thing about that particular population: we are providing. It'd be just like dialect modification.
Yes.
This is a person coming to us who wants to change, does not have a disorder, a communication disorder, but have something that interferes with their perception of themselves, their view of their professional view, and they are coming to us for help with that.
Mhm.
So that is the basis. Now, if you think, if let's say you have a strong Christian faith and you have a strong, um, you don't believe in it.
Mhm.
Well, using your faith, it says directly in Christianity, if you're only going to help and be friends with people like you, you're not a Christian. By definition, you're reaching out to all people. So you're reaching out to them, you're showing them human kindness, you're showing them acceptance, not necessarily acceptance in their choice, but their acceptance that they are inherent of, back to this, they have inherent value.
Yes. Yes.
Even from a pure evangelical, most conservative point of view, if that's what you need to do, think of them as somebody whom, if you show kindness, you could bring them to religion because of the kindness that you've shown toward them, toward the compassion you've shown toward them. Now, what people do with that is entirely up to them, but we are required to reach out to all of these people. So, Jesus stopped the stoning of the woman, and Jesus would have stopped the stoning of a transgender person.
Yes.
People need to think about the time that he lived. Though I think it was adultery, I don't know what it was. So women were very, very low on the totem pole. No rights, couldn't go enter into the Jewish temple, couldn't enter into certain places. Um, so the woman with the bleeding problem, that was considered an impure woman, and it's implied some curse. He was asked directly about the blind man. Was he blind because his sin or the sin of his father? And he says no, neither. You know what I mean? So when you talk about reaching out to the Sumerian woman at the well. So this reaching out to people who other people have rejected, who have looked down upon. Lepers. You can't get any lepers were just as that society is transgender or in this society. So this outreach to all people is very essential. I remember the whole thing with the Pharisees. Why are you eating with these people? These tax collectors, this woman who is implied that she's a prostitute who comes and washes the feet of Jesus with her hair, and they were appalled that you would even let this woman touch you, and all that. And he gives them a talk about her great faith. So the marginalized are the people you are supposed to treat with kindness.
Yes.
And that's just it. So you're not violating your faith by treating somebody who you think is morally doing something wrong. Those are not in conflict, because everybody you're treating is doing something wrong. So let's just be honest. So since everybody you're treating by definition is a sinner, well, you just got to leave the field. Like that's I told the student. Are you going to give every client a moral fitness test, and only if they pass will you treat them?
Yeah.
We do not. Said we don't get to pick. A doctor doesn't get to pick. Now, a doctor can pick their actions, like a doctor can choose not to give an abortion. That's a perfectly reasonable thing. That an act. That's not. So the person is who they are, but this is requiring you to do something against your belief system. That is perfectly acceptable. You know what I mean? But the woman who has had the abortion, you are not to mistreat.
Yes. Okay. So in my little world of pediatric feeding and swallowing, that falls down onto me and the seeking to understand what foods the family
That's
can
right.
seeking to understand what recommendations I give.
That's right.
And since I started my career in Virginia, over in the Hampton Roads area, then spent 12 years in South Carolina, and then good Lord moved us to South Carolina on a January Friday the 13th, and moved us back to Virginia on an April Fool's Day. So that's how I know there's a good sense of humor in the universe. But since moving back here, I've been exposed to different faiths that I wasn't familiar with in South Carolina. The Quaker, Mennonite, Amish faiths that are here in Shenandoah Valley, I've had, prior to coming, I had had very limited experience engaging with individuals of that faith, of those faiths. And then there's also another culture embedded within Appalachia. It's not, my one of my cousins joined the church, and they don't call it a church. They don't celebrate Christmas. They don't celebrate Easter. Every day should be Christmas in your heart. And It's somebody, if you're listening and you know what it is, message me. They
Mhm.
call each other brother and sister. And
Mhm.
um, but what I didn't know was that within this faith, they don't microwave their food. And
Mhm.
so they're bringing food into the clinic, and I'm supposed to be doing feeding therapy, and the leftovers are like clearly, they've driven like an hour to get to the clinic, and the
Mhm.
leftovers are cold. And so I'm like, oh, I can just heat it up for you really quick. The look of abject terror that,
Mhm.
and I didn't, it was the landmine I didn't know existed that, of
Mhm.
course, I stepped on because,
Mhm.
y'all, if they exist, I will clinically do it. But
Mhm.
I use my foibles, I think this is the correct pronunciation
Mhm.
of that word, to grow from, right?
Mhm.
And so it was an opportunity for them to tell me about their foods and about
Mhm.
their faith. And it was, here I have worked so hard in the last 12 years to understand, when working with my members of the Hispanic population that I
Mhm.
worked with in South Carolina. Um,
Mhm.
we had the migrant workers would work the fields. And so,
Mhm.
depending on the seasons, you would see
Mhm.
certain families again.
Mhm.
Um, to understand where rice came in as a main staple as opposed to like a potato,
Mhm.
how to alter ITSE recommendations when they got the results back on a modified barium swallow study,
Mhm.
what would work and adhere to their culture. And this was something that I hadn't even considered. And folks, this is where, when we're doing our assessments and we're doing our treatment, you don't
Mhm.
know unless you ask.
That's right. So, and food and drink is part of every single religion.
Yes.
There's thousands of religions,
Yes.
and it's part of every single one. As
Yes.
far as our field, communal, some level of individual prayer and communal prayer, every single religion. So, communication and eating, feeding, swallowing are central to every single religion.
Yes. And
And we have to do it. I know I had a former student, she was a Korean from Korea, and I've kept in touch with her these old 15 or so years. So she was saying in Korea, they have family soups that are very important to them, homemade family individual soups. Not that all of them are completely different, but they have their own thing. The child was on a G tube, and she was putting the soups in the G tube,
yeah.
which could be obviously be very problematic. I said, did she tell her doctor she was doing that? She said no, because she knew the doctor would object. Now, if you told the doctor and the speech pathologist this was very important to you, there's something you could work out. But
Absolutely.
by knowing that they would completely reject them, maybe turn them into family services for
Uh-huh.
abusing their child, they're not telling them. So we don't know all the things our clients are not telling us because they do not trust us to
Yeah.
tell us the information because they think we're going to judge them.
Yes. Yes. But if we okay, one, I had a little one whose family had, every Saturday morning they would go get Chick-fil-A chicken biscuits with
Mhm.
Chick-fil-A sauce. And when
Mhm.
that sweet baby that I worked with, her brain tumor and dysphagia progressed to the point that she couldn't take in anything, even pleasure
Mhm.
foods, by mouth. Don't you know that daddy tossed everything in a blender, pureed it, added a little water, and that sweet baby girl would get her Chick-fil-A sauce and chicken honey biscuits
Mhm.
every Saturday morning. But
Mhm.
we had established trust that they told me that.
Mhm.
Well, if you
Mhm.
had told me that as a super green CF-SLP, I probably would have been appalled that it wasn't
Mhm.
a organic, pre-broken down formula. But
Mhm.
folks, there's so much research now behind real food in feeding tubes. So,
Mhm.
but again, it goes back to, have you established trust and
Mhm.
respect as a human?
Mhm. That's
Okay.
right. And the thing is that in terms of faith, compared to other health professions, speech is actually almost dead last on this. OT has a very robust thing about faith and faith practices and OT. Medicine is increasingly doing research on the role of faith and healing and all of that. We are behind, and I think one of them is historically our PhD programs came out of, I don't know, both theater, but a lot of it psychology. And of the professors, in terms of religiosity, psychology professors are among the lowest.
Yes.
The highest, by the way, college professor that have strong religious faith is nursing.
That,
So yeah, you
that
can see, yeah, nursing, the caring component is a very historical part of nursing,
yeah.
not just the technical part. But I think that root of ours and that belief in the pure science, which is in the medical model, which is in socially historically in medicine, is that we fix things. We fix things like a mechanic fixes a car,
Yes, but
and
that's
and
not
then
what
that's
though.
and that's to our detriment because ironically, well, not ironically, but factually rather, treating people like that is the least effective treatment.
Okay, so and when we have to come back for a part two, but
Mhm,
folks, there is, oh God, there's so much more to unpack here.
mhm,
But I minored in art history. I minored
mhm,
in history, art history, special ed a lifetime ago.
mhm,
And I mirrored my history classes with my art history classes for a
mhm,
purpose because I could learn the history better because it was told through art, right?
mhm,
This has been going on for millennia. They manipulated the art to
mhm,
tell the stories to those that were illiterate, right?
mhm,
They, at some of the original Catholic Church meetings, they took out whole female authored chapters of
mhm,
the Bible because
mhm,
they didn't want women in power because they were
mhm,
focusing on a patriarchal society.
mhm,
So, I mean, so I say all of this because, folks, we can tear apart religion. We can
mhm,
tear it apart and reveal all of the cruelty that has happened in its name since religion was conceived in all faiths.
mhm,
But that's not what we're here for. What we're here for is to say that each one of us has a faith
mhm,
in some way, shape, or form.
mhm,
Each one of us has been called to honor the humans that we serve,
mhm,
and I mean that in like a spiritual professional sense, not a slavery indentured servant
mhm,
sense, right? So let's just part and
mhm,
parcel those words out. But in order to live the faith that I was raised into, that means I'm going to ask the crucial conversations of the
mhm,
caregivers and patients that I see, and also of the students that I'm mentoring and supervising. I want to instill this in them so that they learn better than what I was taught. Is
mhm.
that is that a good?
Yeah, yeah. We have to. Uh, uh, so yes, but sometimes the Christians or they're not quick to condemn the extremes because they get defensive,
Yes,
saying, "Well, you're attacking my faith."
yes,
No, I'm attacking the perpetrators of the faith.
yes,
In the Bible, it says, Jesus says, there will be false prophets who will speak in my name.
yes.
So, but that you know a person by their acts, not because you're saved by acts, but their behavior, how they treat the neighbor, how they treat the stranger, how they treat the immigrant, will will show you who they really are.
Okay, folks, I have to cut us off, and trust me,
Yes.
God knows I don't want to. But Dr. Travis, two quick requests. One,
Mhm.
can we come back and do this as a panel discussion because I have an idea for a follow up?
Yes.
Awesome. Thank you. Thank you for coming on. And two, where could somebody make a donation if they feel so moved after listening to you? Where could they share a little bit of their love money this month?
The Asha Foundation, which I already regularly give to.
Thank you. Everybody, you have the power to be the source of good.
Hmm.
You can live your faith. So go live it big. Live it big and know that we are doing our part to live it beside you. Thank you for coming on.
Thank you for inviting me.